Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. We're talking today about Hooked. That's the title of our show. And Dr. Prather, why title this show Hooked?
Well, I got the inspiration from the New Time magazine. For those of you who've seen it out there, on the June 15th, 2015 article, they've got a big hook going right through a pill. And it's about the most powerful painkillers ever invented. And it's created a crisis in America where too many people are hooked on those painkillers.
Yeah, they even titled the article, "The Price of Relief. Why America Can't Kick Its Painkiller Problem."
Yes.
Wow. So let's talk, I know that article was very interesting to you.
Yes.
And let's start with opiates. What are opiates?
Well, opiates are medications that actually interfere with the pain receptors. So very, very good medications for relieving pain, but they also stimulate the centers of pleasure, too. So they have a very strong effect on the brain, and it's something that our body actually naturally will make with endorphins and enkephalins. And
we can naturally make that?
We can make products that are very, very similar to that.
Mm-hmm.
So when we actually take those, that actually stimulates different areas of the brain that are naturally stimulated. It's a something that we can produce as a natural painkiller.
So when should opiates be used, and when shouldn't they be used?
Well, opiates, they actually have a lot of different types of effect on the body. And one of the problems with opiates is they will reduce our own body's ability to make their own painkillers. So it's something that people become addicted to. It stimulates our pleasure centers. So there's a very, very strong effect on that. Heroin, morphine are natural opiates. So those are something that, that has been around for a long time. We've made our own opiates. We have hydrocodone, oxycodone, Percocet, all those different types of pain relievers. And they became the first line of pain medicine. The problem is we are now using, since 1999, 4 times as many opiates as we used to.
Wow, 4 times.
So pain has increased 4 times in America. Well, that's not true.
No.
We have a real problem here. Now, opiates are very good in short-term type of situations. When you're using it for cancer, end-of-life type of situations, for post-surgical, for immediate pain relief, for some type of injury that you have. Those are all very good times to use opiates. But when you're actually using them for any type of long-term type of use, there's several different problems that actually occur with that. One, the opiates start to lose their effectiveness. You need more of them.
They just don't work.
The longer that you use them, the less effective they become.
Okay.
The body actually becomes used to them, and you need higher levels. Also, it cuts down on your own body's ability to handle pain. In other words, your body's own ability to make its natural pain opiates is greatly reduced. So your pain sensitivity actually increases, your ability to use those types of things. And then also, when you try to come off of them, not only do you have more pain, but also there's the normal, natural types of things that you get pleasure from aren't there anymore. Because not only does it reduce your ability to handle pain, but actually to produce your own pleasure.
Wow.
So life becomes, from the people who've come in here who are addicted to opiates, they said life just isn't worth living. Nothing gives me pleasure anymore. Mm-hmm. Because just like the natural receptors to pain become less able to produce your own pain, you're also less able to produce your own pleasure. So life becomes almost unbearable. So, there's a huge problem there, for any type of long-term type of use. It cuts down on the ability to experience pleasure. It cuts down on your ability to handle pain. And it becomes less effective as you go along. So that's a recipe for disaster.
Well, why has there been, you said there's a 4-time increase in opiates since 1999. Why has there been such an increase in opiate use?
Well, one of the big things is that the pharmaceutical industry has actually had a 4 times increase in a lot of their different types of drugs since they've been able to market directly to people. So there's a very direct correlation between the pharmaceutical industry's ability to market their drugs and the increase in the use of drugs themselves. Very much of a 1-to-1 type of ratio. And the amount of money that they spend in advertising is just absolutely incredible.
Mm-hmm. And that advertising started in the 1990s, that marketing?
Yes.
Interesting how marketing is so important.
Marketing is extremely important. So, when we have that type of situation, of course the increase is going to occur. And we are, United States and New Zealand are the only 2 countries in the world that allow direct marketing of pharmaceuticals to the population.
Just those 2 places?
2 places in the entire world.
And they have more, what I've heard about New Zealand, they have more sheep than people.
They do. They do. And they don't have the same problems that we do.
Interesting. Well, why are opiates bad for long-term use?
It's just not something that is now recommended. When you're talking about long-term type of use, that's when you start to get into problems, because now even orally it doesn't really meet the requirements of what people are actually experiencing. So what people start to do is they start to inject it, they start to snort it to try to get a greater high. It has the opposite effect of really what you're looking for. People actually become more pain sensitive. Not only are you not helping with the pain, but you're actually making the pain worse. So people actually become more sensitive to the pain over a long-term type of a situation. Plus, the whole inability to be able to generate the normal types of things that would give you pleasure are gone. That's one of the side effects of the opiates.
Now, go ahead.
So this is not really something that is considered best practices at this point. So any time that you have a situation where you have to go over 3 weeks of opiate use, there should be some type of alternative that you should actually be finding and figuring out exactly how to work that out.
Well, let's talk about that. Are there other options?
Yes, one of the things that has come out as of January 1st for the Joint Commission. The Joint Commission is the major accrediting agency in the United States for healthcare facilities, both for hospitals, for clinics, for nursing homes. That is the number one accrediting agency, and they have come out with a statement that really alternatives should be found instead of the use of opiates for long-term type of pain relief.
And what are those alternatives that they're stating?
Chiropractic care, acupuncture, osteopathic manipulations, physical therapy, massage therapy, and relaxation therapy and counseling.
Great. Well, up next, let's talk about how the Prather practice deals with pain conditions. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice.
One of the most basic fundamentals that I base my practice off of is something called the Atlas orthogonal technique.
It's the type of adjustment?
It's a specific type of an adjustment, and orthogonal means at right angles. In other words, the head is sitting on top of your body.
That's a good thing.
That's a good thing. Because about 80% of the people don't have that. And it has probably one of the greatest effects on the entire system.
You're saying 80% of people don't have the
atlas sitting on underneath the skull.
Now, the atlas
properly.
we're talking about is the first vertebrae.
First vertebrae under the occiput. So a basic type of thing, and what I found is that probably has the biggest effect on the health of an individual over anything else. So you can actually make the greatest amount of changes with the atlas, getting it in the right position, because it's right there at the base of the skull, which is the center of the autonomic nervous system.
The base of the skull.
Which actually controls all the functions of the body. So the Atlas orthogonal is one of the big bases of what we do and has the biggest effect on the health of the individual. And really, to make any types of changes on the rest of the system to help the body to work correctly, that's the beginning of where you need to start. And when I'm actually working with patients, I make sure that that's in position. Now, of course, 20% of the people don't have a problem with that. So we go on to
So not everybody that walks in the office has that issue.
And not everybody who walks into the office has that issue. But getting that corrected is absolutely essential for me to make the other postural changes and to make the changes in the system.
And I want to bring up here, you're board certified in the Atlas orthogonal technique, the only one in the state of Indiana. Got your training down in Atlanta.
Right.
So extensive training.
I was one of the original 6 in that. So that's a huge basis. So there's a very strong belief system in that. And then also I had my greatest amount of changes in my health through this particular type of adjustment. So I can speak from a personal type of standpoint.
Find out how the Atlas Orthogonal Chiropractic Adjustment can transform your health. Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
And I'm feeling good.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. We're talking today about Hooked, actually an article in Time Magazine dated June 15, 2015, and it's talking about opiates and powerful painkillers and how...
I like what they say, and it's created the worst addiction crisis in America has ever seen, which I think is it's an accurate but a very strong statement.
Yeah.
When you're talking about addiction and creating such a huge problem, and it's one of the big things is a lot of the people had no intention of getting addicted.
Right.
In other words, they weren't going out and getting some corner person to sell them some drug that they knew, was going to be a problem for them.
Right.
These were housewives. Actually, the number one people who are actually getting addicted are women in their 40s and 50s who have some type of pain. Housewife, probably a church-going lady, whose doctor prescribed them an opiate for migraine headaches or low back pain, started to take it, and then found that they couldn't get off. And that is a very common scenario of people who are addicted. I know a pastor who became addicted to opiates. And through no fault of his own, he had some severe pain, prescribed opiates, and became addicted. So, this is a crisis of people who are well-meaning, who have no tendency towards actually, illicit drug use, who are becoming addicted to this and then not being able to get off.
Yeah, they title it "The Price of Relief: Why America Can't Kick Its Painkiller Problem."
Correct.
And they tell, stories. One story of a gal who went to her doctor. She had pain, started on pain medication, and then she was cut off after 2 years, after a car accident.
2 years, yeah.
And then now is so addicted she's going to the black market,
Sure.
to get.
And one of the common things that people are doing is heroin. The heroin has increased dramatically. And people are going to heroin because it's actually easier to get now on the black market and cheaper than opiates. So it has really fueled the whole heroin addiction that's becoming such a crisis in America. So, the healthcare, what's supposed to be, creating the healthcare of America is actually
do
creating
no
this
harm.
whole problem. Yeah, do no harm.
What happened to do no harm?
So, this is a huge crisis that the United States government is having many different types of meetings over. This is causing a huge amount of problems. Even those people who not necessarily being affected that are finding that when they check on car crashes, a tremendous number of people right now are on opiates when they're actually getting into car accidents. So this is becoming a crisis really for everyone, and everyone should be concerned about that.
Well, and you said since 1999, the use of opiates has grown 4 times.
Yeah, the use of opiates has grown 4 times. In 2012, there was 1.9 million people addicted to opiate drugs through prescriptions.
How many?
1.9 million.
Wow.
And there's 517,000 heroin addicts out there. And it's growing quite quickly, and the opiate addiction is actually fueling that. It's also caused a crisis in HIV and Hepatitis-C because people are actually sharing drugs. As a matter of fact, southern Indiana, made the headlines because Governor Pence actually ordered free needles to be given out because so many people were hooked on opiates down in that county that they were that the Hepatitis C and HIV
they were sharing needles.
They were sharing needles, so everyone was becoming infected. They found 3 generations of people in one house who had all become infected with HIV and Hepatitis C through the sharing of needles. So,
I know that they mention Governor Pence in this article, correct?
Correct. So, and he's a very conservative person, and for him to start, talking about providing free needles, we've got a real crisis here. So not only do we have the addiction, but now we have an increase in Hepatitis C, in HIV that's also occurring. So this is a very, very big problem. And one of the things that's very shocking is they say 14.4% of pregnant women are prescribed opiates.
What?
Yes. So, of all the women who are out there who are pregnant, almost 15% are being prescribed opiates for pain.
Wow.
And that creates something called neonatal abstinence syndrome. Basically, the babies are born hooked, and then they have withdrawals. So that has become a major, major health crisis. There's absolutely no way that a woman should be put on an opiate if they're pregnant.
Right. Wow.
And really there should be very, very clear-cut reasons on why you're putting on an opiate. For, post-surgical, it's excellent. For immediately after an injury, for a short amount of time before you can actually get the decrease in your ability to handle pain. Just for maybe a week, 10 days at the most, until you can get to some type of care. Cancer, with people who are suffering from cancer, end-of-life type of things. Absolutely, opiates are amazingly effective and helpful.
As long as you know the history of, if there's addiction, though,
Well, in those types of situations, that can be okay. But a post-surgical type of situation where they cut somebody open, you need something.
Right.
But yes, you have to be aware that if there is any addiction that's involved. But besides that, really, according to the Joint Commission, the best practices at this point, the first line of defense for any type of a pain situation needs to be chiropractic, acupuncture, osteopathic manipulations, physical therapy, massage, relaxation therapy, much more going natural to help with the ability of the body to handle pain. And the interesting thing is that they found from different types of research that it is every bit as effective as the opiates.
And there's no addiction.
Well, it actually increases the body's ability to actually handle pain.
Yeah. Well, let's talk about how does the Prather practice deal with pain conditions? Because, we don't see people, and if they come in and they're on painkillers, they're not on them for very long.
No, we're able to work them off very, very quickly.
So let's talk about, and you said this is from the Joint Commission on new pain standards. These are new pain standards to get away from the opiates overuse.
And they've also had back in just recently in May there was a whole presentation by the Drug Commission to Congress on what they're doing about this whole situation. And they're trying to switch people and prescriptions, changing the mindset of doctors out there to switch over to this type of care. And it's something that we're actually getting referrals for.
Right.
The VA is actually referring quite a few patients who have expressed a desire to get off of pain meds.
Yeah.
And this has been a very, very good alternative. We've been able to work everyone off of their pain meds that have come into our
it's
office.
nice they have a chiropractor there they work with, and then they're referred here for the acupuncture.
Sure.
Yeah, so it's nice. So why chiropractic? Actually I was thinking of someone that came in today, or not today, but this week, who called that morning, and we got in because she could barely walk. Not sure what triggered it.
Sure.
And so maybe explain how, the Prather practice goes about evaluating and treating her.
Sure, and the chiropractic is very important because if you don't have the basic structure, usually most pain that is low back or even headaches are caused by a misalignment in the vertebrae or in some joint. And if you don't get that straightened up, that irritation just continues.
Right. That's why x-rays are so important. We take digital x-rays to know exactly what's going on.
Sure.
For example, this gal, what was going on with her vertebrae?
Actually, it was a disc.
A disc, okay.
Yeah, bulge disc. So what we did on that, was we started her out with some electrostimulation, with some acupuncture, and was able to get some definite relief at that point.
And some of the inflammation, because acupuncture helps with inflammation.
Inflammation is absolutely the main thing that acupuncture works on. And then we've also now done a chiropractic adjustment on her, which she could tell some immediate relief. So, when you use the chiropractic, what you're doing is getting the structure where it's supposed to be. If you don't have the structure proper, then you can't actually make progress on the care of the patient because you have that constant irritant. So, I had a patient who came in, got some acupuncture, and had an excellent relief for neck pain. But I told her, because she says, well, it's starting to come back after 2 days. I said, but you still have the irritant there. So let's take some x-rays, see what's going on. It was very obvious what was going on, made the correction. Now she's starting to get the long-term type of relief.
Okay. Well, up next, let's talk about the benefits of acupuncture for pain, something called auricular therapy and decompression. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
New study every day contradicts an old study. Some of them are just plain odd. Did anybody see this? 60 Minutes got a hold of this one. A full segment they did on dogs in healthcare. I see some nods. I think we're going to have different breeds eventually for different specialties, If you're choking on something, you need to see the retriever, right? Here, Heimlich, new patient. Go get him. If you're anemic, you need the bloodhound. And if you have any kind of GI issues, well, you need a referral to the Shih Tzu. So...
Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com. The title of the show is Hooked. And talking about the article in Time Magazine, and actually you're seeing it everywhere. It
is just pervasive. We've had patients that that we've actually even known who are addicted, and the first thing, of course, is to get them so that they no longer have the pain, which is very, very important. So the chiropractic is essential to be able to get the underlying problem solved. The other thing that's very, very important that's part of our program is acupuncture. And the thing that acupuncture has been proven to do is to increase the body's natural endorphins and cephalons and also the natural anti-inflammatories. So instead of you taking painkillers outside of the body actually regulates itself and actually produces its own. And the benefit of that is, one, you actually get better and quicker pain relief. Now, let me repeat that. The people that come in here can all testify that they actually get quicker, longer-lasting, deeper pain relief with this process than they do with the opiates. So, after I take out the acupuncture needles after 15 minutes, they say, does that happen all the time? Though my pain's all gone. Mm-hmm. This is even better than taking the Percocet. Mm-hmm. And I said, yes. And it's all natural. And it actually helps the bodies to continue to produce its own painkillers. So whereas the drugs reduce the body's ability to handle pain, you actually become more sensitive. This actually decreases your body's, the pain the pain sensation. So you're actually more able.
Yeah. And we see this all the time.
We see this all the time.
This gal that came, you said, with the bulging disc.
Sure.
That first day, she was crawling in.
Right.
Crawling in. Her mom had to bring her. The next day, I think her dad brought her. She was walking.
Sure.
More upright. Third day, she drove herself in.
Sure. And that's pretty good. And those are 3 days in consecutive.
Uh-huh. Right.
So it shows you how quickly those responses actually occur. Mm-hmm. And it's actually much better, much quicker, than, and long term.
Why not help your body
Sure.
do what it needs to do?
And interestingly enough, acupuncture stimulates the pleasure centers of the body, which is also one of the benefits of the opiates. But it increases your own body's ability to produce those pleasure centers. Mm-hmm. So, I have people
People say that they feel great.
Oh, yeah. There's just this euphoria that's afterwards. And I have people who actually come in, high executives, things like that, who have very stressful jobs, who are handling things. And they come in, at the beginning, a couple times a week to get the acupuncture. No pain. Mm-hmm. No real, it's just that, I need some help to kind of handle all the stress.
Right.
And then they start to work down, and then eventually they're down to, and they say, I need my once-a-month treatment for my acupuncture. Because I sleep better, I enjoy life more, things don't bother me as much. Mm-hmm. And that's the benefit of acupuncture, stimulating those pleasure centers.
Mm-hmm. I remember a patient saying it was better than any orgasm she had. Maybe I wasn't supposed to say that. That cracked me up.
Yeah, that was pretty funny.
Yeah, maybe that's what we should market it. And then acupuncture use will increase 4 times.
Right. And we don't have all the problems. That's the great thing is the acupuncture is completely safe. It actually it actually stimulates the body's own ability to handle pain and to increase pleasure.
Mm-hmm. Interesting.
Fantastic.
Well, let's talk about something else that the Prather practice provides for pain. And in these things we're talking about at first, we have a passive care model.
Right.
And it's usually 3 weeks long, depending.
2 to 3 weeks.
Yeah, 2 to 3 weeks, how often people can come in. It includes the chiropractic, the acupuncture, and then auricular therapy. And a lot of people, it's probably one of the most powerful things we do here, but a lot of people don't know about it.
Oh, yeah. I would say that there's no one that starts out in our office that actually knows about that. That's something that I definitely always have to explain. But it's a very, very powerful type of therapy. As I say, we're getting the alignment with the chiropractic so that you don't have the ongoing type of irritant that's going on. We also have the acupuncture, which helps with the pain and inflammation. And then we use the auricular to help to heal up the nervous system. And the ears are the conduits to the brain. Matter of fact, auricular is probably the most proven therapy in the world because right now you can do MRI studies on the brain, do the auricular therapy, and you can see directly the changes that occur.
I want to make sure to spell auricular so people can kind of visualize that. It's A-U-R-I-C-U-L-A-R.
Yes.
Auricular. Yeah.
And which just means ear. It is microcurrent on it, and people sit there and say, well, I'll give it a try, and then after they do it, they're like, oh, yeah, I'm going to keep doing that. Mm-hmm. Because, again, there's just this relaxation, balancing of the nervous system. It really helps you can target the sciatic nerve. You can target the brachial plexus. You can target those places that are painful and get some very, very immediate relief. Also, balancing of the parasympathetic, sympathetic system, autonomic nervous system. It's just very, very important to have done.
And we do something also called point stimulation, where a person can wear the unit on their ear for 4 days, 3 days off, and we reevaluate. And that's been really effective for
we've
pain.
had several people say it changed my life. Mm-hmm. And that is, again, another type of auricular therapy.
Mm-hmm. Right. And we're going to see more of that, as we move away from the painkillers and the opiates.
Absolutely.
So part of the passive care also is decompression therapy. And Dr. Prather, what is decompression therapy and how does that benefit?
Well, I had a good example is we had a gentleman who had severe arthritis through his neck. They said even surgery wasn't going to work. Mm. So, he came into me sort of as a last desperate type of thing. We had set up the package, and he didn't really want to do the decompression at that time, so we did the chiropractic, acupuncture, and auricular. And he said, well, all my pain's gone. Mm-hmm. I have no discomfort, anything like that, but I still can't move my neck. Mm-hmm. And so I said, well, that's a joint problem. That's really the decompression. What happens when you have an injury to a joint, it will lock up. And when it locks up, then you no longer get the nutrients in there because it's not really a blood supply. It's a fluid type of thing where the nutrients go into there. And when that starts to occur, then you start to have degeneration, both of the disc, of the joint. That's really what kicks off the arthritis. And with decompression, what you do is you take that joint and you pump it. Mm-hmm. So that pumping action actually gets rid of the old fluid that's in there, gets in new fluid, so you actually get the nutrients, and then you can start to get a definite change in the joint itself. Starts to actually regenerate. Mm-hmm. So after we started on the decompression, he did a series of that. Then he could actually turn his neck for full rotation. Mm. So, it's another different type of way of working with it. And again, we're looking at different things having different effects on different aspects of the care.
Right.
And one of the things that's nice is we have a whole package on that.
Right. And then from passive care, we move people into active care because it's not enough to just be out of pain.
Correct.
Right. And
now you have to get the function back.
Right. So why is rehabilitation needed?
Well, actually, you would even be better at that because you're head of the rehabilitation department.
I am, but I'll let you talk.
Okay. The rehabilitation gets the function back. You have restriction of motion, you have tightness in the muscles, you have weakness in certain muscles, and those have to be brought back into normal.
Yeah, it's just like any structure of a building. As you're getting the structure aligned, and it's so nice because you make my job so easy. By the time I see them in active care, they're out of pain. Mm-hmm. If they've been on painkillers, they're usually off painkillers.
Sure.
By then. But what we're talking about, and a lot of people say, well, I do exercise, but this is corrective exercise.
Totally different.
Yes, which is nice. You're able to go over the x-rays with us. We're very specific on the exercises we do, the corrective exercises, and the results. Because we tell people, we don't want to keep you coming in,
right.
in this.
And it's not really a complete care. I could get through all those different things. But if we didn't do the rehabilitation, if we didn't do those therapeutic exercises, we'd be doing a disservice to the patient.
Right. Well, up next, let's talk more about, treatments that meet the best practice standards. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice.
I consider the blood work to be the blueprint to your health, and we've had several different radio programs on that and talked about how important it is to have at least a yearly complete blood test to find out where you are. The blood is the life force of the body, and it gives an amazing chemical picture of where you are with your health, and can actually pick up all the different types of diseases that could be going on. So having a thorough blood test is one of the most important things and is recommended by everyone to make sure that your health is up to where it should be and can actually pick up any type of disease process before it becomes a major factor. So having a good blood test, a good thorough blood test, is one of the most important things that you can possibly have. One of the things that I implemented when I started my practice was a blood test that could actually cover any type of problem that was actually developed that someone could actually experience. So we came up with a profile, we gave it to the labs, but they said, wow, that's a pretty good profile. Do you mind if we offer that to other people? And I said, no, that would be fine, because I feel that that's something that could be very useful. And they named it the Prather Profile. So I've actually met with other doctors before and talked to them and said, "You're Dr. Prather. Are you the Prather of the Prather Profile?" And I said, yeah, because, they get a list of different profiles. And so it's actually now a national profile. So we actually have 52 different lab tests that are actually included in this profile. It covers everything from A to Z. In other words, any disease process that you could possibly have in your body, that will be covered by this particular blood test. So it is something that should be done by everyone, from no matter how young you are to no matter how old you are, at least once a year, to see what your health is. If you have a problem, this will actually pick it up. And one of the nice things about that is it is actually covered by insurance. So very excellent way of actually finding out where you are, and if there are any hidden types of problems that are going on, this will actually show it up.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. Well, we're talking today about the most powerful painkillers ever invented and how they're creating the worst addiction crisis America's ever seen. I'm reading from Time magazine,
Correct.
dated June 15th, 2015. And, I've looked at this all week. It's seeing that hook, and I didn't realize that's a pill on the hook. I'm just, detail. But let's talk about the treatments at the Prather Practice. Does your treatments meet best practice standards?
Yes, as of this year. Of course, these were procedures that we had put together feeling that they were the best practices.
Mm-hmm. We've been practicing for a long time.
We've been practicing for a long time. Mm-hmm. But it is now confirmed that this is really the best practices. As of this year, the Joint Commission, which is the leading accrediting agency in the United States, also the congressional recommendations, from the commission that was actually presented, is that we now need to move away from opiates, and the first line of treatment should be, again, the chiropractic, acupuncture, things like the auricular therapy, natural types of products, which we'll talk about a little bit, physical therapy, massage therapy, and relaxation therapy.
Yeah, and I have not fully read the article, but it'd be nice if, were those things brought up in the article?
They were not.
Yeah, we're just going to talk about the problem here,
Yeah.
not the solutions.
One of the things that, that some people are saying, well, we come up with new drugs. Well, just by their...
come up with new drugs.
Yeah, why not use the body's own ability to heal itself? And these are really things that use on that and actually have been proven to be not only as effective but more effective, especially if you use in combination.
What about surgery?
There are times for surgery, but one of the things that they found in surgery is that after 5 years, everyone was better off if they didn't have to have surgery. Let me repeat that. After 5 years, you're probably worse off if you've had surgery than if you didn't. Now, there are times where you absolutely have to have surgery, but surgery should not be a first, something that should only be a very, very last result. A very interesting statistic is if someone went to an orthopedic surgeon or a neurosurgeon first, about 40% of the time they wind up with surgery. If they go to a chiropractic acupuncturist first, less than 1% actually wind up in surgery.
Wow, less than 1%.
Less than 1% actually wind up in surgery.
I know with patients said, I'm possibly going to need a hip replacement or a knee replacement. I want to do everything I can to avoid that.
Very smart idea. And the longer you can go, the better off you are. Now, are there times where surgery is absolutely necessary? Yes. But only if that is the very last resort. And there's no other option. You should always explore all the other options first. One of the problems is if you go into an orthopedic surgeon, first thing they do is they send you to physical therapy. Well, physical therapy is very important. But physical therapy does not deal with the alignment. It doesn't deal with the pain levels like acupuncture does. It doesn't work with it like auricular therapy. It's a part of our program,
Right.
the rehabilitation, but it shouldn't be a standalone. Matter of fact, none of these things should really be standalone.
They all need to work together.
They really need to work together. That's why integration is the best way to go. And going to an integrated facility where they offer all those things is really where you're going to get the best results. Because as you do them in combination, your results go up dramatically.
Very important.
And I see each one of these different types of areas very helpful on their own, but none of them get the same benefit as if you're combining them.
Right. Right. And we have, we've had this protocol for a while, and it works. It works. So moving people from the passive care to the active care, and not that every person's program's the same,
Right.
but definitely have practice standards.
The combination just makes a huge, huge difference.
Okay, well, let's talk about what should someone do if they think they're addicted or their family or friend is addicted to opiates.
Seek help immediately. People cannot work off of these things on their own. They need different types of help. One of the things at our office is we do offer a program for that. We have some excellent help along those lines.
Counseling. Yeah. And in fact, our show last week was with Art Adams, who offers counseling at our office. And one of his specialties is addiction. He does much more than that. So that's definitely one area that we have at our office.
Yeah, and one of the things is that he's just very, very proficient in that area, has a tremendous amount of experience and some specialty in that. But we also offer quite a few other different types of things that are very, very effective. The auricular therapy is one of the more proven therapies to help to stop addiction.
You're seeing that in a lot of drug rehab centers.
Right.
as a standard of care.
I've known people who actually worked at rehab centers, and they said that the auricular therapy they felt was one of the most effective means of actually helping along those lines. So very, very good results along those lines. Acupuncture is extremely helpful.
And I know one thing that Art always says is realize, if you're out there and addicted to opiates or a family member or friend, you're not alone,
Right.
and there is help. It shouldn't be a hopeless thing. So know that you're not alone and there is help out there. And there's a lot of alternatives.
Certainly.
I think of a gentleman that's come in that was addicted to painkillers and is doing so much better. Off his painkillers now, feeling great. He's a new person.
Yeah, his family has said that they just they've got him back again. Because he said all pleasure in life had just gone away.
Right.
And he just wasn't the same person. I mean, when he first came in, the staff weren't quite sure if they really wanted him because he was, there was some belligerence, there was some inappropriate behavior. And he's just the nicest guy you can ever meet right now.
That's true. Right. Just
just so cooperative and so positive about life. And the drugs change you. They change your personality. What you would normally do, and I've known people who were addicted, who would steal from people that were beloved by them,
family members.
You just aren't yourself anymore. You can't make rational decisions. Your morality drops so dramatically. So understand that this is a disease. Your brain has been changed. You are no longer yourself, and you need help. Quit trying to do it on your own. You can't.
Right. And one thing, too, I was thinking of a gal that came in this week with, she drives about 3 hours away to see us. So she's coming in once a week initially, which isn't ideal, but had shoulder pain. We have natural topical, the TD1 that we offer, that we gave her a topical along with pills that build up the joint, correct?
Sure.
And the next time we saw her, most of her pain was gone.
See, and that's one of the things that we also offer is there are things that you can take that are natural that have excellent results. That don't have all the addictive qualities to it.
Right. I was even thinking homeopathic medicine.
Absolutely.
And we have herbals that we can give. So very important for alternative to pain meds.
Certainly. The other thing is that we have people who really, with the really acute pain, that was just beyond their body's ability to handle. And trying to get things under control quickly, was something that they were getting relief, but it wasn't fast enough. We also have topical, very, very strong medicines, which you can actually put on there. So they are prescription, developed by the United States Army because obviously they don't want someone driving a tank who's on opiates, because they tend to shoot the command center.
Right, not a good idea.
Not a good idea. So they have actually developed the ability to get pain medicine, even stronger than you could take orally, into that area, and only 10% of it gets into the bloodstream. So you actually get greater pain relief with less of the, it's just not addictive. It's just not having any of the problems.
Okay. Well, good show, Dr. Prather. Hooked. The Price of Relief, Why America Can't Kick Its Painkiller Problem. And the problem, what we want to leave the listeners with is their solution. It's already been proven. There's new pain standards out there, and it needs to move that way.
In that direction.
Thank you.
Thank you.
The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather. Healthy Habits from the Prather Practice is a natural weight loss program with a proven success rate. Healthy Habits is an individualized program that is tailored to each patient's needs. Healthy Habits is not a trendy diet. The program actually resets your body's metabolism for optimal fat burning. The Healthy Habits program includes concentrated vitamins and minerals that help you to burn fat and feel more energetic. Healthy Habits provides support from a counselor and exercise physiologist in order to maximize your results and help you create new healthy habits in your life. This program even helped our own Dr. Prather to lose 24 pounds and shed 4 inches from his waist in just 12 days. Schedule your consultation with a Healthy Habits counselor at the Prather Practice at 317-848-8048. That's 317-848-8048, or on the web at thevoiceofhealthradio.com. The Prather Practice, restoring hope.